I want you to move from overwhelmed by information to confident in what really matters. I want to help you move from being unsure towards direction and purpose in your healthcare. I want to introduce you to health experts. I want to let you in on tough conversations on women's health. I want to give you a place where you can lean in and learn how to take care of yourself. Let's transform your health. Let's get clear on your goals. This is Women's Health Unplugged. I'm your host, Dr. Jordan Robertson, naturopathic doctor. There's something kind of romantic about using herbal medicine to treat symptoms and to treat your health. It was one of the things I was kind of attracted to when I originally went to the naturopathic college and became a naturopathic doctor, is that I wanted to believe that there were solutions out there for health conditions that offered a more, I don't know what the right word is, whether it's peaceful or I guess natural way of supporting the body and supporting symptoms that didn't create more problems than it solved, which is sometimes the way that we can observe, the use of pharmaceutical medications, and really felt like a more empowered choice around choosing health and wellness versus the way we can sometimes feel, again, about pharmaceutical medicine as being a bit of a Band-Aid approach. Now, you know me well enough to know that to me, the evidence of using any particular intervention with a patient population still trumps as the most important thing that we do, and really the most important part of that decision-making process for me as a clinician. But I like understanding and knowing what solutions are available that fall in the spectrum of botanical medicine for patients, because quite often that helps patients make a value-based decision about how to support their health. I want to know that those things that they are leaning towards or the things that I'm recommending for them have the evidence to do what they want it to do, right? It's not really enough for us to say, I want to use this herb because I like the flower on it and I like the smell of it, and I'm hopeful that it's going to help support me in my health and wellness journey. I'd like to know that the solution that people are reaching for has a more robust body of evidence to support its use and is going to actually get them to where they want to go in their health and wellness journey. Today's episode is all about botanical medicine in that perimenopause and menopause midlife change. And we're going to talk about the evidence for using botanical medicine to support your symptoms and how it can help smooth that transition for people that are entering those kind of tumultuous hormonal years. Today's podcast is actually sponsored by Smart Solutions. I've worked with Smart Solutions as an educator for the last year, and I'm really encouraged by their continued dedication to also provide evidence-based information and products and solutions for women to support their hormonal health needs. Part of the reason I like working with perimenopause and menopause is that it can leave women feeling confused about their hormones, and we often don't have a practical solution to stop their symptoms from getting in the way of the way they show up in their day. Smart Solutions offers products, and it contains ingredients like chaste tree and sage and things that we're going to speak about today that have been shown to improve mood and hot flashes in perimenopause and menopause. And these botanical ingredients can help smooth that transition that women experience during this phase of life for people that are transitioning through menopause. Smart Solutions has offered a promo code for today's episode. And if you enter Jordan10 at checkout on your next order at smartsolutions.com, you can actually receive 10% off. So I want to thank Smart Solutions for putting information and quality and evidence-based information into the hands of women and people in menopause so they can get back to taking care of themselves. So let's start by talking about how to choose a botanical ingredient and what to expect if you're going to choose botanical solutions for your challenges. I think some of the disappointment we can get when we're looking at symptoms and support for menopause in general is that we often look at our symptoms of menopause as being very dichotomous, meaning, do I have hot flashes? Do I not have hot flashes? Do I have a low mood? Do I never have a low mood? Do I have, the ability to sleep through the night, or do I ever wake up? And really, where I want to start the conversation is starting to think about your symptoms, your hormone shifts, and your experience on much more of a spectrum of symptoms and a spectrum of severity versus a dichotomous yes, no, hot flashes, no. When I train educators or train physicians about this conversation as well, I'm really mindful that we need to set really clear expectations for women around what to expect when they start to use any solution for menopause. It's not uncommon that whether we give a medication like hormone replacement therapy or a herb and we prescribe it to a woman, she takes it home, she tries it for 3 days, and she calls the office back and says, I still have hot flashes. And when that happens, I think we've done a bit of a disservice in our level of education that we're giving women about how to expect the outcomes of their treatment to go. But we also, as women, need to recognize that our the absence of symptoms is maybe, I'm not going to call it an unrealistic goal because I don't want to make this sound hopeless. But also, if you had one hot flash and you used to have 50, like we're doing pretty darn good. And so, one of the most important things that people in menopause and women can do is to get a really good baseline understanding of the symptoms that you're experiencing, track the severity, track the frequency, and track the duration, specifically with hot flashes, track the duration of your hot flash. Is it 20 seconds or is it a minute? So that when you start to add solutions to the mix, that you actually know whether or not you're on a path towards better improvement in how you're feeling. And so anytime we're treating or supporting the symptoms of menopause, I want to know that the good days are better and the bad days aren't as bad. I want to know that in general, we're having more symptom-free periods of time. And when your symptoms come in, they're not as severe. And that's really how to think about and how to track your symptoms as you start to explore solutions. And that's whether you're using a pharmaceutical solution or whether you're using a botanical solution. So, either way, whatever you choose to support yourself, if you had 6 espressos, you might still have hot flashes, right? If you have a really stressful conversation with your partner before bed, you might still have insomnia. None of the things that we're using to support mood or hot flashes, especially in a botanical perspective, are a sledgehammer against your symptoms. They're a gentle, supportive measure that helps blunt or lessen the experience of hormone fluctuations that we have around menopause, but it really doesn't have that sledgehammer effect. And I think if we can enter a treatment plan or solution building conversation with that mindset, we can have way higher compassion for ourselves in menopause, which there's lots of evidence that that's an important part of improving your symptoms as well. But it also allows you to stay the course for treatment. So doing something for 3 days is really not going to teach us anything about whether or not that nutrient or supplement or botanical or medication has really got you to where you want to go. You didn't do it long enough for us to see like the natural variation of your life, and in those 3 days maybe had skewed our understanding of whether or not it was going to work for you or not. So I want you to go into this conversation with that in mind, that one, nothing that we give for hormonal symptoms is a sledgehammer, because your hormones are responding to your life, as well as the nutrients or botanicals we're going to discuss, but also that your baseline tracking of how you're feeling really helps us understand where we're going. And so if you can watch a percent reduction in your symptoms over time, that's a really positive thing to be able to communicate back to your practitioner to say, okay, I've noticed this. And even when I first started working with patients in menopause, I was disappointed by treatment options. And it wasn't until I did a really deep dive into the literature on nutrients like sage, which we're going to speak about today, did I realize that patients didn't see improvement or a notable improvement for many weeks after starting it. I'm like, oh, damn it. Like I was expecting things to happen faster. I probably switched solutions or stopped treating something faster than I should have. And so to me, this has become part of where I feel like the education is so important for patients. Whether we're treating PMS or perimenopause or menopause, we need to see consistency over time to really make accurate reflections on how things are going. So keep that in mind as we go through the conversation and as you look to get solutions for your own health and wellness or communicate what your needs are to a practitioner, that we're keeping that in mind. So let's start by talking about sage. And I've reached for sage for hot flashes for a long time in my career. And actually, the majority of research on sage in the early days, maybe 10 years ago, was actually done on non-menopausal patients. And so, where we found the benefit is actually helping support patients who are going through hormone changes as a consequence of chemotherapy or radiotherapy, men and women, actually. So, men who are having treatment for prostate cancer and put on hormone blocking medication, as well as people going through treatment for breast cancer, are both at risk of having hot flashes. And this is a population where the purpose of the treatment that they're on is really to block their hormones. And so they're not really candidates, or we've thought for a long time that they're not candidates for hormone replacement therapy. And so exploring interventions like acupuncture and like other non-hormonal solutions was really important for this patient population. And so a lot of my early prescribing for hot flashes was borrowing information that we found on sage being used for these other patient populations, because we found that it reduced those, we call them vasomotor symptoms, so meaning the night sweats and hot flashes in people who had hot flashes because of hormone therapy, like hormone reducing therapy as a consequence of their cancer treatment, not because they had naturally lost their hormones as a result of menopause. And fast forward up until like 2019, 2020, we finally have some clinical trials specifically looking at the use of sage in menopause. And although I think we have a lot of room to grow in the area of studying botanical medicine for all symptoms of menopause, sage does decrease not only the symptoms that are associated with hot flashes, but there is some thought that it probably reduces some of the joint pain and other symptoms of menopause that people experience. Now, where I've made mistakes in the past with sage is that I expected it to solve hot flashes relatively quickly. And I think when I initially learned about it from some of my peers, I think we were awfully excited that it could work quite quickly. And even my communication to patients, I communicated that it was going to work relatively quickly. But interestingly, in the research studies, we actually don't see a significant, and by that I mean statistically significant, reduction in hot flashes before the 4-week mark. And so participants and people need to be quite dedicated to using this as an intervention for a significant amount of time before we saw that like severity, duration, and intensity, which are really the three things we track when it comes to hot flashes, before we saw them change enough that it started to show a statistical significance, meaning that the people in the study rated their, they had said, how many hot flashes do you have a day? Okay, well, I have 7. And then maybe they had 6 in the second week and 4 in the third week. But to reach statistical significance means that we want to know that the change that they've had through the period of the study was so good, or we're pretty certain that it's a very low likelihood due to chance. And so what that means is by the end of the study, their hot flashes needed to be different enough that it wasn't a fluke. And we didn't really see that happen until about the 4th week of most of the studies now that have been done on sage, is that it does take about a month for us to see that change in that experience. Now, in my personal experience, have I seen people benefit from it faster than that? Sure. But in the research, we want to make sure that we're following the recommendations, or at least communicating the expectations that we see in the research. So if you're that one person that's like, I tried it for 2 weeks and it did nothing, you might not see that statistical significance until you complete the treatment course, which would actually be 4 weeks according to the literature. So I quite like sage. It does have some estrogenic activity, which we've mostly studied in animal models, meaning that, we can watch in a test tube that if we expose cells to sage, that there is an estrogen action of it, very similar to some of the other herbs that we talk about, or we have considerations for looking at supporting menopause. But sage is really the one that has the greatest support for reducing those symptoms of hot flashes and really outperforms some of the other herbs that you may have read about or may have heard about that helps support hot flashes. This is the one that really has the most significant body of evidence that supports it. When we talk about other symptoms of menopause and perimenopause, one of the challenges that we have in this phase of life is that a lot of the symptoms associated with menopause start to show up even before that final menstrual period. And I've talked about perimenopause a lot on the podcast. It's maybe my most interesting or it's the condition that I'm like the most interested in because I find it so fascinating about what's happening during this phase of life as the ovaries kind of, sputter out those last remaining follicles and how that influences the way that women feel. I find it absolutely fascinating. So one of the challenges that we have is that women are often making, haphazard levels of hormones during this window of time, but they're oscillating between like low hormone levels, which may bring on symptoms like hot flashes, like we just talked about. But also they may have these haphazard periods of hormone production or even a true ovulation where they make, a lot of hormones. And so women, as they approach their final menstrual period, may still experience symptoms of PMS, which is annoying. I say like perimenopause is like putting menopause and PMS in a blender, and you have no idea which symptoms are going to show up in which month. But that's why when we start to look at the botanicals that support women and people in midlife that are having hormone transitions, is we start to think about the same group of herbs that support people with PMS, because it's actually there. It can feel like a PMS on steroids experience in perimenopause. And it's also less predictable what that experience each month is going to be. Chaste tree or vitex is a herb that globally has way better recognition for PMS than we have in North America. And there are some European countries that actually have chaste tree on their like drug compendium that is suggested to be used for PMS. And so in North America, where we would treat a lot of the symptoms of PMS with the oral contraceptive, which just blocks ovulation completely, or we would patch repair some of the symptoms, like say with an antidepressant, chaste tree actually has this potential to support the physical and mental symptoms that people experience when their hormones are all over the place. And there's many countries that reach for it first. Versus considering it to be an alternative treatment, whereas we do consider it to be an alternative treatment in North America. The benefits of chaste tree, in my opinion, are that it does have this like overlap between mental symptoms or mental emotional symptoms, depression, crying, irritability, sadness, but also has this benefit on some of the physical symptoms associated with PMS and perimenopause, whether that's breast tenderness or bloating. And what people find when they take chaste tree is that over a 3-month window of time, that their severity of symptoms with respect to hormone fluctuations does start to improve. And the 3-month mark, so it's not that it takes 3 months for them to feel any better. It's just that when we think about this perimenopause, menopause transition, like capture any 3 months and it's going to be different than another 3-month window of time, right? So like I said at the beginning, if we're not sort of committed to making some of those changes and looking at some of those hormone supports, we might miss an opportunity or miss an understanding of how impactful it is, because your hormones are changing so much that, if you take chaste tree on a Tuesday, like we have no idea if it's going to help, because this Tuesday might look very different than last Tuesday and like 6 months ago Tuesday. And so when we're tracking perimenopause or PMS, we really do require patients to track their symptoms, but also to moving forward, look at their symptoms over quite a long period of time. And most of the research suggests that we do that, by tracking symptoms for 3 months. So this herb is neat because it has sort of like multiple actions in the brain. It lowers prolactin, which is one of our the hormones that we make in our pituitary, which is associated with lots of symptoms in the breast. And it also seems to decrease pain and probably influences mood through some of the opioid-based receptors in the brain, which is kind of interesting. And so with all of those hormone fluctuations that we see towards the tail end of perimenopause and as we move into menopause, many women and people in menopause benefit from this additional support of a herb that sort of smooths out some of those transitional experiences. Because when hormone levels are, I keep using the word all over the place, and it's because our production is haphazard. It blunts how negative that can feel, because part of how we feel in perimenopause is based on hormone fluctuation, not just the loss of hormones. And so that's why chaste tree ends up being one of those herbs that we look at. I can't think of a symptom that people come into my office with more than talking about brain fog, because it's pervasive and it shows up in lots of areas of people's day, right? So if they're having a symptom that, is in their work, it's in their personal life, it's maybe in their hobbies. I think brain fog and fatigue is probably the most dominant symptom. And certainly and this, I'm a huge advocate of having a really well done workup when you're presenting to your practitioner with fatigue. It's not enough to just say, well, what do you got for fatigue? And we give a botanical to support it. There's so many things that happen in the menopause transition with respect to thyroid health, with respect to insulin resistance and metabolism. Cardiovascular health risks change at menopause. And a lot of these underlying things will have a fatigue either as a primary symptom or as a consequence of those changes. And so if you're struggling with fatigue and brain fog, it's really not enough just to, pull something off the shelf that says this will make you smarter, we promise. I really think it's important that you have an established relationship with someone who's willing to talk about your fatigue and not just be like, yeah, girl, makes sense. Like, you got 3 kids, you got a busy job, your parents are, aging. That's not really good enough, in my opinion. That's never been a good enough assessment for why women in their late 40s are tired, because they have big lives. They had big lives when they were 32, right? As 30 as well, also at 32. And so it's not good enough for me for us to just say circumstances or what makes people tired, or that aging is what makes people tired. I think it really is warranted to have a much deeper look, especially since some of those periods at the end of perimenopause can be quite heavy. We're talking iron. We see a lot of change in thyroid function during perimenopause because of the interrelationship between thyroid and estrogen. Like, we got to look at these things. However, perimenopause and menopause does bring symptoms of fatigue, loss of concentration and focus, and brain fog. And herbs like rhodiola, herbs like ashwagandha, have evidence for supporting that fatigue experience in women during menopause. Now, clinically, I certainly, you could probably imagine, like, with the population that I see, that like everyone would be a candidate for those herbs, but it's not something I use like with significant regularity, or the expectation shouldn't be that you need these kinds of nutrients forever, right? And if you're using an adaptogen, or if you're using something on the daily to treat your fatigue and focus and concentration, I would beg you to have a bit of a deeper look at what's going on there, because the purpose of those herbs and the purpose of things like rhodiola is to alleviate some of the distress that the brain and nervous system feels as a consequence of stress. So when we're stressed and our nervous system starts to feel like the demand is outweighing its resources, which is really what happens in our brain when we feel stressed. It's not the stressor. It doesn't matter if you're looking for a parking spot at the mall, or if you're giving a presentation at work. It's your brain's perception of resources that influences whether or not we actually truly feel stressed. And so some of these nutrients like rhodiola actually helps improve that like allostatic load, meaning that your brain actually feels like it can do it. And so your perception of fatigue and the symptoms that often go along with overwhelm and fatigue are lessened. So there are studies of looking at how to support stress and burnout in women in menopause, and these two herbs both come up. Improves sort of like those, that experience of fatigue for women. Ashwagandha specifically also has some evidence for improving sexual function in women in menopause. And we're going to transition to talking about sexual function. Most of the research on ashwagandha is actually done in a male population. And what it does is it decreases the suppression of testosterone that's happening when males are stressed. So that cortisol, the rise in cortisol that comes from stress actually does decrease testosterone production. And we're not super clear whether or not that's also how it helps improve things like sexual function in a female patient population. But that's where the sort of conversation about ashwagandha and sexual function is. It's in that stress reduction, testosterone, cortisol soup there. We don't quite have enough evidence to say that that's for sure why it improves sexual function in women. We know that the topic of sexual function is really complex in women, and so likely the solutions also need to be more complex. Women, struggle with changes to vaginal tissue during this period of time, and often require a lubricant for sexual function during penetrative intercourse. Women often have, higher levels of stress or distress, changes in their mood, which, when we think about things like ashwagandha, that's maybe the role that plays. There are other herbs like tribulus that also have been looked at for sexual function in perimenopause. And where I believe, and again, this is me borrowing a little bit from the literature, is we see improvement in sexual function in patients who are on antidepressants with tribulus. But we also see improvement in sexual function with patients who are in menopause with tribulus. And so I don't think those two things are unrelated, even though what we haven't done is like run a study on the use of tribulus for mood in menopause. That would be the next step. But we are seeing that improvement in sexual function, meaning that women have an easier time achieving orgasm. They have an easier time engaging in sexual activity, meaning that the thoughts cross their mind. They have less low sexual desire when they use tribulus. Again, one of the challenges with treating any of these things is that, again, you can't just do it one time, right? It's not Viagra. It's not like take your tribulus and you're, suddenly 23 years old and raring to go. It's a reminder over time to your body about the way that we want it to function. And so it needs to be done on a consistent basis for us to see that level of improvement, right? You could be taking tribulus and still be kind of mad at your partner. And it's not going to help your sexual function, right? Like that is a very complex symptom to support. But it's encouraging to see that a natural, safe intervention, whether it's ashwagandha or tribulus, can be used in combination with things like, support for vaginal atrophy and then the in-the-moment lubrication to help support women get back their sexual function that they feel like they've lost around menopause. That is one of the most distressing symptoms about menopause, is that change in sexual function. And it's happening on all levels, right? Mood, sleep, changes to stress, and then also the physical changes that patients experience vaginally. They all stack up to having a more difficult time being interested in and then achieving pleasure when you do, end up engaging in sexual activity. That having solutions like that, I think, are valuable. And certainly that's an area that I think should deserve some more focus. Like sometimes I notice when I'm working with patients and I'll say, well, how's your sex life? Or tell me about your sexual health. They're like, nah, it's not that important. Or nah, neither of us really care. I'd like to bring that up more to the forefront of people's health and wellness. And so knowing that a lot of the solutions we're searching for or seeking for this stage of life also have evidence for supporting sexual function is quite positive. So that was a pretty quick overview of some of the heavy hitters in the world of botanical medicine for menopause. And I certainly, you're probably left with more questions than answers. And there's some great resources out there. I've done lots of writing for Jameson and Smart Solutions on this topic, which is available on their website. But I certainly would encourage you to talk about your symptoms with your practitioner as well. So sometimes I think that because there's over-the-counter solutions available for people, and they can trial and error some of these options on their own, that it prevents them from having these good, deep conversations with a person who can pull together their whole case and say, okay, do this blood work, track these symptoms, and here are the solutions, which can be quite a valuable step that people can make. But I'm also grateful for the opportunity for people to be able to learn about and support their own health and wellness journey with nutrients and pharmaceuticals and options that align the best with their values. I think if you're making some value-based decision about how you want to be supported in your health, my ultimate goal for you is to understand the research as well so that you feel not just like you're making this like empowered value-based decision, but it's one that's actually going to get you somewhere. So I totally want to thank Smart Solutions. This is the first time we've ever had a podcast episode be sponsored. And it's great to be in alignment with a company that offers the products that are evidence-based, that have the support and research to back up what they're actually going to do with patients. And if you hopped on midway through this episode, you might have missed that at the beginning, Smart Solutions is offering 10% off if you enter Jordan10 at checkout on your next order. And they do offer solutions for menopause, perimenopause, and PMS that contain the ingredients of the podcast that we talked about today. And so I wanted to get that information into your hands and for you to know that we have great partners out there that can support you in your health and wellness journey. I hope you enjoyed that episode of Women's Health Unplugged. My goal is to help you feel more confident about your health. Please remember that what we talked about today in the podcast does not constitute medical advice, nor was a doctor-patient relationship formed. If you have questions about your healthcare or about how today's topic pertains to you, please take it up with your family doctor, your specialist, or someone on your health team.